Good afternoon. My name is Dr. Gabriel Skelly, and welcome everyone to this emergency summit on the international response to the current crisis of COVID-19 management in the UK. I'm here as a representative of the group of scientists who wrote to The Lancet recently, calling the government's plans a dangerous and unethical experiment. Because the UK is at yet another crucial juncture in its management of the pandemic. The Westminster government has failed to bring the virus under control and is now preparing to remove the last few measures that inhibit the virus spreading even more widely amongst our only partially vaccinated population. We've brought together for the next hour scientists from around the world to highlight what is happening in the UK. We've world-leading experts from 10 countries, including current advisors to government and former advisors to government. And we will be hearing from them and taking questions from the press. And we look forward to a very useful discussion. I think it's indicative of the situation we are in, that there is such worldwide interest in what the UK is attempting to do or proposing to do. Can I first go to our first intervention, again from a fellow author of that letter of to the Lancet, Dr. Deepti Gurdasani from Queen Mary University of London. Deepti.
Thanks, Gabriel. We're in the midst of an unfolding national emergency in the UK. Our government has progressively abandoned most protections for the public in the middle of what is a raging pandemic and will remove the remaining on Monday. Over 1,000 scientists, healthcare professionals have come together to sign a letter in the Lancet asking the government to reconsider this reckless strategy and take urgent action to protect our public. Yesterday, we had almost 50,000 daily cases and hospitalizations of 600 per day, which are straining an already devastated health service. Only about half of our population are fully vaccinated, and we have been told to expect that millions will get infected over the summer, with case rates reaching about 100,000 per day. Our government has chosen this path despite having safe and effective vaccines available that could have protected the millions who will now be exposed to a novel virus and its long-term consequences, leaving a generation with chronic illness and disability. We know the world is watching this crisis unfold in the UK, and we appeal to the international community to come together in solidarity with us and help convey the seriousness of this emergency. Thanks.
Thank you very much. Now, can I go immediately to Professor Michael Baker from New Zealand, one of the advisors to the New Zealand government. Coming from a country, Professor Baker, that has followed a strategy of not tolerating the virus at all, suppressing the virus entirely, and very successfully, what is your view on the current events unfolding in the UK?
Well, I'm amazed, and that's why I'm one of the signatories of the letter. In New Zealand, we've always looked to the UK for leadership. I mean, you have a remarkable depth of scientific knowledge. You've done incredibly well with vaccine development and rollout, remarkable clinical trials that we're drawing on. And that's why it just seems so remarkable that you're not following even basic public health principles here. You started with an approach of herd immunity, of assuming that mass infection with this virus would protect the UK population. And of course, that was rapidly identified as a completely unacceptable approach in terms of disease burden. It seems now strangely that you're going back to that approach, given that it has failed so dismally around the globe. So we are, and my colleagues in New Zealand are quite astounded that you're doing this despite the amazing expertise you have in the UK.
Thank you very much, Michael. Can we now go to Professor Meir Rubin? Meir, thank you for joining us from Israel, where you're an advisor to the government of Israel on risk management and national policy. The UK is often compared with Israel because Israel has done very well, like the UK, in terms of vaccination, with a high level of vaccination. And it's often the argument that's being used by the government that we can open up because half of our population are fully vaccinated. What's your perspective on this?
We know, first of all, I'm not a professor, sorry, I'm a lawyer, but we know for sure that even the best vaccines are only a tactic and not a strategy. If you're going for mitigation, not for elimination, they will hold for a while until they collapse under the next variant. So in Israel, for example, we have a place named Kochav Yair. Over 80% of the population is vaccinated twice with Pfizer, and they still had a serious outbreak where many kids got infected and also infected their parents. And in Israel, we have the biggest households in the developed between the developed nations, and an infectious carrier of Delta will infect his family even when they are fully vaccinated. If you live with a child that is a Delta carrier, he will infect the parents because of the time of the exposure and the amount of exposure. People are becoming infectious by themselves. So the Israel Minister of Health actually claimed that the effectivity of Pfizer vaccines against getting infected and infecting others, again, not becoming a severe case, but against becoming infected and infecting others, dropped from above 90% to around 60%, which is very bad. And right now we see in Israel an outbreak of about 100 cases per million people a day. Yesterday we had over 850 new confirmed cases. And we see a rise of severe cases in ICU. For example, 3 days ago, we had 11 new severe cases, all of them fully vaccinated twice, all of them above 50. And we know that this, and we also see dead people dying, even though that they're fully vaccinated. We had more than 7 people dying in the last few days, fully vaccinated, all of them. So we see that from the 850 positive cases yesterday, about half of them are fully vaccinated. In Israel, about 2/3 of the population is fully vaccinated. So we see that the vaccines are extremely effective, but they only hold for a while. And because Delta is much more infectious, the only difference that we see is that if before the vaccinations and Delta, about 7 to 9% of the confirmed cases had to go to hospital. Now it's only 5 or 6%, but this is less than one double. And double in time now in Israel is just a little bit over a week. So everything we gained, when we look at the netto gain, security gain from the vaccines, we earned one double. We earned between 7 to 10 days to act aggressively before we are in the exactly same situation like before the vaccines. And actually today, the Israel Corona Cabinet, which is chaired by the Prime Minister, got an emergency meeting. They sit right now. They started 8 minutes ago because of the new information from the UK about 54 kids getting hospitalized yesterday, which is the all-time record from the first day of the pandemic for one day. And you have, I think, 37 kids, 7-day average, 37 kids hospitalized a day. This is bad because in Israel we have so many kids, and because no kid under 12 is vaccinated, and from the kids above 12, only very few are vaccinated already, none of them fully vaccinated. We take this very seriously. And Israel, I must say, we didn't seriously have a strategy until November 2020. Our official strategy is still mitigation, not elimination, which is very bad, because it's failing time and again, and none of the tactics is actually working. When you don't aim for elimination, even when you get there, it's hard to keep it there. We already got for elimination twice, on May 2020 and on May 2021, and we lost gaps because we were not appreciating it enough. I really hope that the government in Israel will change course soon from mitigation to elimination, protecting our kids until we can vaccinate all of them, hopefully on the first quarter of 2022. And I think we will see a lockdown in Israel in few weeks, unless we act very aggressively now, which I still hope that we may do. Thank you very much.
Thank you very much, Mayor. Important lessons there about the ability of people who have been double vaccinated to actually contract the virus and become ill. And also, I think about overcrowded households or large households. And it's a particular problem in many of the cities in the UK, that issue of particularly in deprived population living in overcrowded households. So thank you very much. Can I move now to Professor Christina Pagel from University College London and a colleague of mine on Independent Stage. Christina.
Hi, everybody. I think one of the reasons I wanted to be on this panel and what I'm most worried about is in fact, there was a letter from leading virologists about this in the Financial Times this week, is the potential for a new variant to emerge this summer. When you have incredibly high levels of COVID, which we have now in England, and it's not going to go away anytime soon, and a partially vaccinated population, any mutation that can infect vaccinated people better has a big selection advantage and can spread. And because of our position as a global travel hub, any variant that becomes dominant in the UK will likely spread to the rest of the world. We saw it with Alpha. I'm absolutely sure that we contributed to the rise of Delta in Europe and North America. So that's my perspective, is that the UK policy doesn't just affect us, it affects everybody, and everybody has a stake in what we do. And I'll end there. Thank you very much, Christina.
Could I now go to the United States, to Dr. William Hasseltine, Chair and President of Access Healthcare Health International. Dr. Hasseltine, what do you think of what the UK is intending to do and its potential for impact across the globe, and also how it looks from a US perspective? I think you need to unmute yourself, Professor, or be unmuted.
We have always looked to the UK for good, sensible policies. Unfortunately, that has not been the case for the COVID pandemic. What I fear is that some of the worst impulses, especially in many of our states, will follow the UK example. It is leading to disaster, as we can see in the numbers. I follow the numbers daily in the UK, and I am extremely dismayed to see the very rapid rate of increase in infections in a population which is vaccinated pretty much like we are, about 50%. I think the messages we are hearing from Israel, which is another marker for success in the vaccine field, is also extremely disturbing. It says that even if you get fully vaccinated, we must follow serious control efforts and to try to eliminate, not just mitigate the problem. Vaccines alone are not going to do the job, but certainly policies that release and open up the country in the midst of a growing wave of infections are counterproductive in the most extreme.
Thank you very much for those comments, and do stay with us, Dr. Hasseltine, if you can. Could I now move to Professor Jose Martin Moreno, who I've known for a very long time as one of the most distinguished public health experts across Europe. He's not only a leading academic, he's a former Director General of Public Health for Spain, the equivalent of Chief Medical Officer role. Jose, from all your wealth of experience, how do you regard the UK's current position and potential future tactic?
Thank you, Gabriel. I am enjoying this session because I am fully agree with the previous statements. I think the UK policy does not only affect to the British citizens, it affects to the world. And actually, the UK is a reference. It's a reference model, a reference country. We admire the science there. So that's a pity, and we cannot understand well why this is happening in spite of the knowledge, which is, scientific knowledge that you have. But having said that, for example, this is also mimicking and actually is imitated in other countries. The country I know best, Spain, our prime minister decided to actually remove on the 26th of June the mandatory use of face masks at the outdoors. And at that time, we had only 80 cases per 100,000 as cumulated incidents. Now we have over 500 cases per 100,000. This is a real example. It's a natural experiment of what a disaster we can do if we remove the restrictions that are the tools to contain the transmission. This is it.
Thank you very much, Jose. Do stay with us for as long as you can. I know you have.
Thank you so much.
But thank you very much for being here. Now, can we move to some views from and advice from experts from other places? I think one of the countries that many people have looked to has been Taiwan. Can we hear from Professor Shuqi Chao about from Taiwan, which has done such a remarkable job in controlling the virus? How does the UK's current position and future progress under this new initiative that the government is taking to remove the restrictions, how does that look from a Taiwan perspective?
Yes, thank you, Gabriel. And actually, UK's situation has caused a lot of discussions here. We saw there are a lot of new cases, and the death number is rising too, okay? And here, we are surprised to see that you will have a complete reopen very soon, including the reopening schools. And I'm personally very much concerned about the young people who do not have a chance to be vaccinated, since current, there is no vaccine available authorized for people under age 12. And I believe that everyone, regardless of age, should enjoy equal freedom from preventable COVID sequelae. And so for young people who cannot be protected from the government's immunization program, and if the infection may cause significant consequence upon them, then the government will have to do something to protect them without leaving them behind. And I believe this is a political responsibility to assure that young people enjoy the same freedom from COVID sequelae. And actually, according to studies in Italy and elsewhere, actually, although a mortality rate among young people is low, but the long COVID is very prevalent. The prevalence of long COVID among young people is much higher than we would have expected. The Italian study showed that more than one half of children aged with mean age 11 actually suffered from at least one symptom after they were called recovered. Okay, and we know that schools are a special setting with very high risk. So here in Taiwan, we have the specially made masks for children with different ages. We apply universal masking in schools, and it's important to pay attention to any new case in the class or in the schools. And testing, contact tracing, isolation, etc., must be done to avoid the spread among children and the spread to the families and the communities. So, and actually these measures have been, you are familiar with these measures. So I believe that since students are not vaccinated, and these public health measures are effective, and you are familiar with that, so actually, these measures should continue to protect them. And in our culture, there is a saying that it's unethical to take the umbrella away from persons while it's still raining. And now it's politically unethical to take the umbrella away from persons not having a raincoat when it's still raining. So, and it's actually raining very hard. So I hope the politicians can take it into consideration to keep the umbrella there for those people not having a raincoat.
Thank you very much, Professor Chow. That was wonderful. I think your analogies of umbrellas and raincoats is very powerful. Unfortunately, in UK, our umbrella, for example, testing and tracing has had holes in it. It's been a very poor umbrella. Not fit for purpose, and our raincoat, in terms of masking, we still seem to have a belief in droplet spread, and we're using face coverings rather than proper masks in general, and we haven't really properly adopted the mask. So thank you very much for your advice and your views. Now we'll go to some questions from the press, and the first one is from Stephanie Bolson from the German publication Die Welt.
Hello, sorry, I thought that the moderator was reading out my question. I'm sorry.
Oh, no, do please.
Okay, then my question is, and I read it to you, the British Prime Minister has said last week in the press conference, if not now, when then? So it's the best time now, it's summer. If you do it in the autumn, it will be much worse. So there are so many experts there. I don't know who wants to answer that, but in your view, when is the best time to lift the restrictions? And also, this is now, as some of you said, Germany is very much looking at what the UK is doing, because the UK is a blueprint. So what would be your advice to the German government what to do? Thank you.
Stephanie, thank you for your question. It's one that is indeed asked and posed quite regularly. Who would like to answer that?
It's Stephen Duckett from Australia here.
Hi.
I think there are two criteria that you should be considering. First of all, is the pandemic under control? And secondly, is the population protected? If you open up when either one of those is not the case, you are doomed to a exponential spread of the virus, exponential increase in hospitalizations, exponential increase in deaths as a consequence. So you've got to have both the pandemic under control, so it's hard not spreading essentially, and secondly, you've got to protect the population. In Australia, we've more or less got the pandemic under control, but we haven't protected the population. We've got very, very low vaccinations. You'll still have neither of those in place. You don't have high enough, even though you've got very good vaccination rollout, it's still not high enough, as we heard from the Israeli example, and you still haven't got the pandemic under control. So it's foolish to open up right now.
Thank you very much, and good to have you with us, Stephen. Thank you. Can I also pose Stephanie's question to Yanir? Yanir Baryam is president of the New England Complex Systems Institute, and he's one of the founders of the recently launched World Health Network. Yanir.
I think the word that we've heard is that from scientists around the world is that opening up when the pandemic is still propagating in the population doesn't make sense for protection of the public. What we can do is take advantage of the opportunity to suppress the outbreak radically, so the when we should act is now, but the action should be in the other direction, to gain control of the outbreak, as Stephen just said, so that then we can open up safely for the public, for children, and for others who are vulnerable, but for everybody, because everybody is affected once the pandemic is out of control. Thank you.
Thanks, Yanir. Would any of our other guests like to come in on this question? Yes, Professor Pago.
I just wanted to say that no country so far has reached vaccination levels where they've been able to open up fully and not with high cases and not have a problem. Chile had to go back into lockdown twice, even though it's very highly vaccinated. Other countries have really struggled. Israel's the only place that really managed to open up very slowly and carefully and keep cases really low. And that was under Alpha variant. And now, as we've heard, Delta is causing new issues. So no country really has the protection from vaccines to release all restrictions yet. And I think we just have to wait. We just have to wait. I mean, we're still in the pandemic.
Thank you very much. We've got some other questions. So if I can move on to Randeep Ramesh from The Guardian. Randeep, good to have you with us. Would you like to ask your question?
Sure, Gabriel. Can you hear me all right?
Can hear you very well.
Great. I'm going to have to read from the screen, so just bear with me. On Monday, England CMO, Professor Chris Whitty, said that there was a, quote, overwhelming wide agreement between scientific and medical opinion in support of the UK Prime Minister's plan to open up. My questions are, can this be true, given the number of experts warning about the ending of all legal restrictions, without apparently any government measures to reduce the likelihood of infections mixing with others, or physical distancing? Is it true that only the date of opening up is contested? Is it not also debatable whether the manner of England's opening up is right or not? And the government and Professor Whitty are relying on warning people to go slow. That's the only message that we seem to have. Surely that can't be enough.
Would anyone from our guests like to come in on that? If not, I'll answer it for you, Randy, if I may. it is absolutely, it's plain, as they say in Belfast, a blind man on a fast horse can see that this is a strategy that doesn't have the support of scientists universally at all. And I personally was amazed at some of the comments. The idea that it was a good idea to have the virus spread widely through the population and infect people, make them ill, and have them die so that we got that over with before the autumn. Go in the summer, as it was described. And I thought that the comments of WHO's Mike Ryan about the moral emptiness and epidemiological stupidity of a strategy which was fundamentally based on infecting more people with the virus were absolutely spot on. I'm astounded. I've been a public health doctor for 40 years, and I've never heard of a public health strategy like this. As you have heard from some of the experts from around the world, this is not any concept of public health that any public health physician would really recognize, I don't think. Would any of my other guests like to come in on this? Stephen, I can see you smiling there in the, would you like to give your view on
it? You're absolutely right. There is no reputable public health advisor of any kind who would recommend opening up at a time when the virus is spreading rampantly. It just defies any logic, any science of any kind, and it is a recipe to just accept that 40,000, 50,000, 80,000 cases a day is somehow acceptable. What we do know, and what the evidence is from around the world, is if there is no trade-off between public health and economics, that the right decisions on a public health perspective are the right decisions for the economy. So what they're doing with opening up is both stupid in public health terms and stupid in economic terms.
Thank you very much. Can I go to Professor Walter Riccardi from Italy? And Walter, you are president of the World Federation of Public Health Associations, a very important international body representing public health professionals around the world. Do you have a response to Randeep's question?
I think that we can quote the ancient Roman that say, to err is human, to persevere is diabolical, because as Italians, we were struck first in the world outside China. And we already warned our neighboring countries, including UK, that this approach was devastating in February 2020, and is still devastating now. So it's very difficult for us to understand, having a worldwide perspective, why UK, a country that has the best possible public health and epidemiologists in the world, has such figures that advise in a very wrong manner their government. I think this is something that has to be understood. And this is not, of course, is a matter of internal affairs, but this is becoming international, because from England and UK, the virus is spreading all over the world. In particular, I couldn't agree more with Michael Becker, but we are even more closer I mean, there are flights from London every day to Europe. And we already have seen in the past that from UK, the virus spread all over Europe. So I think that it's impossible to sustain such things when the universal scientific community is saying exactly the opposite. So you have to speak truth to the power. And in particular, you have a big responsibility if you are an advisor to the government of a very important country with such important scientific institution, with such important scientific international leaders.
Thank you. Could I turn to Professor Salim Abdul Karim from South Africa and Columbia University as well, of course. And Professor Karim, your views, please.
Thank you very much, Gabriel. So I won't comment directly on the issue of whether scientists agree in the UK. I would like just to make one critically important point, and that is that when we are looking at new variants, and in particular, the Delta variant that's now spreading across the world, it is a more infectious, a more transmissible virus. So that means it has a higher reproductive rate, or R0, which we've all come to know. When you have a virus that has a higher R0 or is more infectious, the level of immunity required to suppress the virus and create herd immunity is much higher. So while the older variants could be inhibited by lower levels of vaccine coverage, you need much higher levels. And so it is really not scientifically sound to be easing restrictions when you are in the midst of a rapidly growing epidemic and in the midst of a highly infectious variant, because it is going to cause, huge numbers of cases.
Thank you very much indeed. So Randy, I think you've had a good range of answers to your question, including from Professor Riccardi, who, as well as holding that global position in terms of the public health community, is also an advisor to the current government. Michael, you want to come in on this before we move on?
Yeah, one comment I would make is, and of course this is coming from a country which has no transmission for the last 3 months, but just going back to first principles, obviously if you can eliminate the virus entirely, that's optimal. But even less than that, if you suppress transmission, you're going to minimize the health impacts. But beyond that, we always think the last resort is mitigation, flattening the curve so that it doesn't overwhelm the health system capacity. So that's one of the things that really astounds me from my knowledge of the NHS, which is obviously a world-leading system. And if the doctors in that system are saying they cannot cope with the likely expected burden of disease, it's not just epidemiologists and public health physicians saying this doesn't make sense. It is the overworked and I think exhausted members of your whole health system saying the same thing. That is what has really astounded me as I guess a distant observer of the debate in the UK. And I don't know if there are healthcare workers here, but that is another, I guess, point at which you would really question the wisdom of the strategy, surely.
Thank you. Thank you very much. Can I remind the press that if you want to ask a question, do message Kitty Tig in the chat. So for our next question, can I turn to Giorgia Scaturo from the Italian publication Il Fatto Quotidiano, if I get it anywhere near right.
It was right. Thank you.
Georgia, hello.
Good morning. I was wondering, one of the facts is that you can still die, you're over 50, fully vaccinated, you can still die. In Israel, we are reporting as much as in the UK. I find it really difficult to find data if there's any difference in the performances of the vaccines. Namely, do we know if what kind of vaccines, what type of vaccines was inoculated in the patients who sadly died after being fully vaccinated? And another question, if I may. So we all know now what not to do, so opening too soon, chaotically as the government is doing in the UK. But I was wondering what sort of roadmap Boris Johnson has a 4 stages roadmap to reopen the society. What kind of roadmap would you suggest instead?
Thank you very much for your question. Is there anyone who would like to respond to that about the vaccines and the roadmap? Deepti, can I turn to you?
Yeah, sure. I mean, we don't really have data in the UK about, which vaccines were given to the people who died. I mean, we think that both Pfizer and AstraZeneca have a high degree of protection against severe disease, but protection against infection is much lower, and we think that it might be differential. I mean, certainly laboratory studies and real-world studies suggest that the response to those, among those vaccinated with AstraZeneca, even with 2 doses, is lower compared to the mRNA vaccines, which of course really brings up the question of, can we reach herd immunity even if we vaccinate 100% of our population, which of course is not going to happen because many aren't even eligible and the uptake is not going to be 100%. And I think the overwhelming answer now from the scientific community to that question is very likely not, unless we have more effective vaccines. So that means that we need to have mitigations in place. We can't just let the pandemic rip through the population. I mean, certainly not now at 50% of vaccination, but even not with much higher levels of vaccination. We need to invest in things like ventilation and put out messaging that people do have to wear masks in the future, because this enables us to have the freedoms that we need as a society and, interact with each other in a safer environment and not have the reckless skyrocketing numbers that we have, for example, in schools right now.
Thank you very much. Thank you for that. We'll move on in terms of questions, and we'll go to Clive Cookson from the Financial Times. Clive?
Thanks, Gabriel. The opponents of lockdown, people who want freedom, quote not only the economic costs, but also the social and mental health effects of keeping people tightly restricted month after month, year after year. And the mental health toll is not something that any of you have mentioned and wasn't mentioned in the letter to the Lancet. So perhaps you could address the opposite side of the coin, not the economic effects, but the social and mental health effects.
Yes, I'm sure we will. I'm not a great fan of the terms lockdown, which seems to me to mean all things to all people. We're certainly not in lockdown at the moment. We have some minor restrictions left, as far as I can see it, and we're certainly not free from this deadly virus. Deepti?
So Clive, I think, has articulated perfectly the false dichotomy that's been created here, because lockdowns are not a pandemic strategy. They're a failure of a pandemic strategy when they're repeated again and again. And the reason we've had to do this in the UK is precisely because the government have failed to contain the pandemic. I think we should really listen to experts here whose countries have aimed for zero COVID or elimination, because the reason that their mental health impacts and impacts from lockdown are precisely because we don't contain COVID. And if a pandemic control is the only way to protect our society, our economy, people's mental health and healthcare. They're not unlinked. And as long as we treat them as unlinked and dichotomous to each other and pit them against each other, we will never get on top of this.
Good, thank you very much. Can I go to Dr. Hasseltine? And I'll come back to you, Clive, if that's all right. Hasseltine, and then maybe to Professor Kang to hear her views as well. Dr. Hasseltine.
Well, I think that Clive has made a very good point that there are very serious societal implications. I've coined a term called COVID-related post-traumatic stress disorder, which is affecting many societies. But one aspect that has not been, I think, discussed here is the success in China. I have offices in China in 2 of their major cities, and I can say my team in China is relatively free from COVID stress disorders. That is because their public health systems, like those in New Zealand and other countries, have been extremely effective. They've had, I think, a model of how you control a major pandemic for an enormous country. I think it's a shame that people, because of geopolitical stresses, don't look more carefully at what that country has done and is doing, even when variants like Delta infect that country. It is a remarkable success for a country with very large borders, very large population, and a complex system. So Clive has made a very good point, but the way to avoid COVID-related stress is to avoid and control COVID.
Thank you very much. Could I turn to Professor Kang, because we haven't heard from you from India yet, and from you yet, and you're a professor in the Christian Medical College in Vellore in India. Do you have any comment in terms of this issue?
I think this whole discussion has been fascinating, and the debate in the UK has been fascinating. So I would like to take you back to January in India, where we had Sero survey data that told us that 55% of our major cities had already had exposure. And then from February to April, we saw what happened with the Delta variant in our country. So 55% exposure in the whole population, not just adults, was insufficient to stop the Delta variant from sweeping across the country, from infections, reinfections, and a lot of hospitalizations and deaths. We now have a vaccination program that is adding to the exposure that we've had to the virus. But looking at the UK, which has had a series of national COVID-19 studies that we have all looked at from the research community as being approaches to address the issues of control, it seems remarkable that you are ignoring the science that you yourselves are producing in order to open up in a fashion when you should not be close to thinking about this situation. Your cases are increasing, your children are unprotected, and you have the resources which we did not have to be able to delay the opening, to open up with caution. I think this is hope trumping experience, and I hope it does not turn out to be a bad experience for you. I think it will, however.
Thank you very much for that warning. Could I go to Professor Stephen Duckett?
Thanks very much. Certainly, if you have lockdowns, in inverted commas, restrictions on movement, there is an increase in mental health issues. There is an increase in alcohol and drug issues. There is an increase in domestic violence. That has been the experience in Australia during the lockdown periods. I've posted in the chat a link to the study from the Australian Institute of Health and Welfare, which summarises some of those mental health impacts. So that is not in dispute. What the question you then have is, what is the worst? What is worse, the impacts on mental health and drug and alcohol and domestic violence and so on, versus the physical health impacts and the overwhelming of the hospitalisation system. So what was put in place in Australia was a number of special initiatives to make it easier for people to get telehealth support, mental health support and so on. So certainly that is something that has to be recognised. Those supports have to be put in place, and you have to then make some call as to whether you think the costs on mental health and other things of the restrictions are worth the benefits in terms of the physical health, hospitalisations and deaths.
Thank you. Clive, do you want to come back on
No, thank you. That was all very, very good. I can see Michael wants to say something else there.
Back to Michael, but there was nothing else from you. Michael,
no, that was perfect.
Good, thank you very much.
Yeah, I was going to respond to your very good question, Clive. And one of the things is, of course, now countries can quantify how much time they've been under lockdown and return to normal functioning. And some of you may have seen that Economist magazine has actually a normalcy index, which is quite interesting. And this looks at or quantifies the ability to return to normal social functioning, travel functioning, and functioning in the workplace. And it shows that there's a strong association, obviously, with elimination. So if you get rid of the virus, you basically have a very good return to normal functioning. And high on that index are places like New Zealand and Hong Kong that have explicit elimination strategies. And also you can use, of course, the Oxford Stringency Index, which again quantifies how much time countries have spent under lockdown. And it's the same thing, that actually countries that use lockdown very decisively and strategically have spent far less time under lockdown subsequently. And that's been the experience in New Zealand, Australia, Taiwan, mainland China, and other countries. So it's not about, it's about using lockdown very strategically and I think in a minimal way if you can eliminate the virus.
Thank you very much. We've 15 minutes left to us. If any of the press who have joined us want to ask a question, do contact Kitty Teague in the direct message, via direct message in the chat room. Thanks very much. Can I turn now to Masato Kimura, who's a Japanese freelance journalist. Good of you to join us. Good to have you with us. Masato, can you ask your question?
Thank you very much. It's Masato Kimura, Japanese freelance journalist. My question is about Seiji modeling. So it seems that Boris Johnson don't care hospitalization, but mortality. But why SAGE can believe the peak out at the range of 1,000 to 2,000? Why in hospitalization? Why the curve is could peak out?
Thank you for that question. That's definitely one for our data expert, Professor Pago.
So the 1,000 to 2,000 is based on assuming we've got between 2 and 3 doublings left before the pandemic peaks, because we've got enough immunity to bring it down over the summer. But there is a lot of uncertainty in it, as the SAGE modelers say, that there's so much depends on who's getting vaccinated, who isn't vaccinated, how it's spreading, whether there are any new variants, all of that. So, it's this, a lot of their models actually say, at the worst end, you could be much worse than we were in January, 4,000 to 5,000 and higher admissions. So but it's basically this idea that we'll top out at about 2 to 3 doublings. So in about 5 to 6 weeks is the idea. And we don't know. I mean, it's an experiment. I think it's a very bad experiment.
Thank you very much. Thanks very much for your question, Masato. Can I go to Ben Quinn of The Guardian?
Thank you. A question for perhaps for Michael Baker or perhaps any colleagues from the European Union. I was interested in what measures you anticipate authorities in your countries to adopt in relation to the UK should a variant appear to be emerging here, and also what measures would you yourself recommend? I'm thinking in terms of travel or general public health measures in relation to citizens of the UK.
Good question, Ben. If I could expand it very slightly and ask the panel about their views of, do they think it's likely that a variant will emerge because of what we're doing, and then on to how we would deal with that, or how other countries might deal with that. Would anyone like to address that really important issue? Dr. Haselton?
The issue of variants is not necessarily tied to the kinds of policies that the UK is following at the moment. It may well be that a variant will emerge, but it could well be from a much smaller population in which some people are immunosuppressed and the virus has a chance to experiment. So we don't have a good fix at this point on what is the root of variant creation. We just know that they're there. And I think that any hope that this virus has a limited capacity to vary is unreasonable. We have looked at these coronaviruses for many years. Every year, the cold-causing viruses come back. They have an enormous capacity to vary. And we're just now beginning to learn how they do it. It's not just the outside of the virus. It's not just the spike. They can vary in very many subtle ways. This virus initially suppresses the immune system, and we're learning that some of the variants, like Alpha, are more adept at suppressing our innate immunity early on. Some other variants are more at aggravating it later on. We have a lot to learn about variants. Unfortunately, I'm afraid we will.
Thank you very much. Anyone else like to come in on this issue? Particularly of the development of variants in a population that is only partly vaccinated. Professor Karim.
Yes, thank you very much. I think we all, sat back in December when we realized that variants, and particularly variants of concern that are able to transmit faster, and even have some evidence of escaping aspects of immunity, as we saw with the beta variant here in South Africa, we realized that variants are going to be something we're going to have to deal with over the long term. This is not something that's going to disappear. And we actually saw just yesterday a statement released from the WHO, just confirming what we've known, that variants are here to stay. And as we look at populations that are increasingly vaccinated, we're likely to see, just in a matter of time, there's a high likelihood we will start seeing variants that can escape vaccine immunity. So it's going to be essential for us to take an approach that was well described by the Lancet Commission on COVID-19, which is one of using a combination of our prevention tools. As we've done with HIV and many other diseases, we don't bank on a single variant, a single intervention like vaccines. And as we look at these variants, already we're seeing in the UK variations on the Delta variant emerging in the form of Delta Plus, and we're likely to see yet more variants. I think ensuring we reduce viral transmission and viral replication is part and parcel of reducing the risk of variants.
Thank you. And the part of Ben's question about other countries' reactions, I've been slightly surprised that at a point in time when the UK was having more cases in the UK than the whole of the rest of Europe put together, that there wasn't more of a reaction from other countries to stop the spread of cases between them. But does anyone have any comments on that issue? Because for me, issues of quarantine have been pretty central to the whole response. Would anyone like to comment? Michael?
I mean, I think the world is stratified into countries that have rigid quarantine, the countries pursuing elimination like Australia, New Zealand, China, Taiwan, Hong Kong, and so on. And certainly, we took a little while to come to grips with variants, and that was really looking at that in December last year. And now we do stratify incoming travelers according to their proportion who are positive, and also the variants that are dominating. And so we are actually turning down the number of travelers we can accept from those countries, because it puts a big strain on the capacity of our quarantine system. So it is a factor, but we're still allowing travelers can come from anywhere in the world into New Zealand. It's just we regulate the numbers so that we can manage it effectively and not put a high risk of, and we do have quarantine failures at a certain rate. So we obviously try to manage that.
Thank you very much. We don't have any more questions from the press, but I have one question I'd like to put to this distinguished panel, because it is a pertinent question to the UK situation. Many people believe that the government is intent on a strategy that is underpinned by a concept of herd immunity, that they will achieve herd immunity by a mixture of infection and vaccination. Now, I personally have very strong views on this matter, but I would like to hear from our friends across the world what they think about this approach, that herd immunity is our way out of this pandemic. Yanir, did you want to say something?
Sure. I mean, one of the things that has become clearer over time is that the effect of long COVID that we've heard is highly prevalent in children that are infected, even for mild and asymptomatic cases. One of the effects that we've found out is that there's significant brain damage, including shrinkage of parts of the brain after acute infection. And we still are not recognizing that severe effect can be very long-term. We do not know how long it will last, of course, but the brain does not heal very well, and having such damage is a significant outcome of acute infection afterwards.
Thanks. Dr. Hasselty, did you want to say a word?
I've written that I believe that the strategy of herd immunity is actually murderous. I think that's a word we should use, because that is what it is. It is knowledge that you are doing something that will result in thousands, and in some cases, tens of thousands of people dying. It is a disastrous policy. It's been clear that that's been the case for some time, and to continue to espouse that policy is unconscionable.
Thank you. Any other comments? Professor Cho, I see you nodding. Would you like to comment?
Yeah, about herd immunity, at least in my country, it's impossible to get herd immunity through natural infection, because our people will automatically restrict their activities when there are more deaths. So there is no way by natural infection to get there. And yeah, as you say, of course, we have better way to get immunity. That is through vaccination. And I also believe that vaccination alone is not enough. We need to combine vaccination plus some containment strategies to get zero COVID status. And that's the best way that people can enjoy true freedom.
Walter, can I turn to you maybe on this issue of achieving herd immunity and your perspective and maybe an Italian perspective on it?
I remember one of the first meetings we had with ministers of health from the most important countries in the world on March 2020. And of course, I cannot mention specifically the ministers who say that, but there were some in the groups that pursue the idea of herd immunity. And we say, this is mad. I mean, I couldn't agree more with Dr. Heseltine. I mean, you must be mad. And this was when we saw people dying in the best hospitals in Italy, I know, with doctors, with the best facilities, with the best technology. You can imagine what can happen in other parts of the world that they don't have this kind of facility. So I think I couldn't agree more. We have to be explicit, and I couldn't agree more with the word used by Dr. Heseltine.
Indeed, I agree. March 2020, I think, was the first time I ever screamed at a television screen, and it was herd immunity that, being mentioned by the British government spokespeople, that did it for me. Anyone else like to come in on this? Yes, Christina.
I just want to say this reflects on herd immunity, but also just in general. I think one of the biggest problems that we've had in the UK is an unwillingness to learn from other countries. As many people on this panel have said today, you know, and I don't know whether it's arrogance, British exceptionalism, something else. There's this idea somehow that we can do it differently, that it hasn't worked and it isn't working and it won't work. And I really hope that people listen to what people have said here today and rethink and change the discussion completely from should we go ahead on Monday to actually what the hell are we doing and how do we get cases down?
And Michael Baker, can I come to you for the last comment on this?
Yes, I mean, it's basic, it's elementary maths that once you have a virus or an infectious agent that's more, where the reproduction number is beyond a certain point, it's a mathematical impossibility to get herd immunity, even with vaccine, unless you have a phenomenally effective vaccine, which of course we have good vaccines, but they would have to be at the level of MMR for measles, for instance, or better, or that level before you could dream of herd immunity through vaccination and natural infection, which of course is a barbaric way to achieve it. So that's a pretty elementary realization, isn't it? You have to have all these other methods as well. I mean, that's so basic. It seems remarkable that anyone could actually still promote that idea.
Thank you. Michael, your mention of measles reminds me of the current UK situation. The UK lost its status of having eliminated measles in 2016. Such was the poor state of our public health system that we had achieved a population immunity to measles, but we have lost it and are not capable of such a response in the UK. And I think that was a shameful system, and it is a shameful system that allowed that to happen. Anyway, we'll finish on that note. Can I first of all thank all our guests from across the world? I think it just shows the importance of what the UK is intending to do. The UK government is the path that the UK government is tending to take us down, that so many people, such distinguished experts from across the world, feel so passionately about the importance of what the UK does that they're willing to come and join us here today. And I thank them very, very much. Could I also thank the many people from the press who've come along and all of those who are listening in on other media. And thank you particularly to the citizens who have enabled this all to be put together, and Deepti Gurdasani in particular, who's just her usual wonderful self in getting everything together for us. So thank you very much, and I hope you have a healthy rest of the day, and that we all meet again under somewhat better circumstances. Thank you very much.
Thank you.
Thank you.